So we can move on to the second portion of the METS platform, which is exercise. And so the recommendation or goal for exercise here is specifically with cardio, 150 minutes per week. So that adds up to about 30 minutes 5 times a week, or less if you do it every day. And along with the cardio exercise, we want some sort of strength training or like weight training twice a week, at least for 15 to 20 minutes each time. And on top of that, we want our exercise to be regular, varied, and vigorous. So what that means is a lot of people will, go out on long weekend hikes and say that satisfies their exercise quota for the whole week. But if you want to see the full benefits of exercise, you want to have a regular routine where you exercise every day or every other day. You also want it to be vigorous. So, it's always good to start off slow if you'd like. But we want, for example, in cardio, we want a brisk paced walk or a jog or a run, anything that increases your heart rate, increases your breathing rate. And for strength training, we definitely want it to be varied. So we want to exercise different muscle groups to reduce the risk of injury, but also make sure you're building up your strength, in all parts. So these are sort of the four main things we look for in exercise. But aerobic exercise and strength training is definitely really important and what we want to prioritize. A lot of people say that they do yoga routines and say that counts as exercise. If there's any strength training involved, there's a lot of core exercises in yoga. That's definitely good, but we want to make sure that we're doing something that increases your heart rate as well as increases or as well as falls under resistance training. So there's been a lot of research done on the importance of exercise for heart health. So studies have shown that people who drive to work or commute to work rather than bike or walk have a higher risk of coronary occlusion, so higher risk of heart attack in the long term. So 3 to 8 hours of walking per week reduce the mortality by 15%, and vigorous exercise, even 1 to 2 hours, reduces the mortality by 35%. So when you have exercise, what that does is not only does it lower your blood sugar, it's called natural insulin, but it also lowers cholesterol as well as triglycerides, which is the free flowing lipids and fats in your bloodstream. So, right after you've had a meal, if you go on a walk, that helps control the spike in sugar levels that you usually get right after eating, which is definitely helpful. And overall, it decreases the risk of cholesterol and hyperlipidemia. And so research has been done on the fitness level. So metabolic fitness is an important term. Basically, when you look at things like LDL, HDL, triglycerides, and blood sugar, metabolic fitness is having a good value for at least 3 of those 4 things. And exercise helps with all of them. So here are some tips and ways that you can add exercise to your own schedule. Obviously, this is a lot different right now because of COVID. Gyms are closed. It's harder for people to get out. So some tips to exercise at home. For example, if you're doing something stationary, standing up, reducing your sedentary time, getting up every 30 minutes to either get a drink of water, go to the restroom. Those are all very helpful. Exercising outdoors with friends or family while social distancing, and adding it to your calendar, setting reminders, anything you can do that motivates you and reminds you to get up and exercise. And so here are some good times that you can do that as well. Yeah, and here's your discussion question for this section. How do you motivate yourself to stay active during quarantine, and what are some exercises you can do at home? Definitely dancing, downloading a pedometer app to make sure you get in 10,000 steps each day. That's definitely good. One thing we look for when we're walking, when people go on walks, is we want the walk to be at a brisk pace to actually count for cardio exercise. So you want to be breathing heavily. If you're walking with someone, it should be difficult for you to maintain a conversation with them. And one way to up your speed and walking is to monitor your step count. So that's really important.